Dr. Mansukh Manaviya, Union Health Minister, India. Ladies and gentlemen, it is now my singular pleasure to welcome His Excellency, Mr. Joe Bijang, Honorable Minister of Health and Human Services, Republic of the Marshall Islands. Your Excellency, please. Ladies and gentlemen, Mr. Joe Bijang, Health Minister of the Republic of the Marshall Islands. It is now my honor and privilege to welcome Dr. Poonam Khetrapal Singh, the Honorable Regional Director, WHO Southeast Asia. Dr. Poonam Singh, please. Madam Regional Director. May we please welcome our distinguished delegates from the countries in the order of the English alphabet. From Denmark, Mrs. Nina Bergstedt, Senior Advisor, Office for Data Infrastructure and Cybersecurity, Ministry of the Interior and Health, Denmark. From Mozambique, Mrs. Bernardina de Souza, National Deputy Director for Health Training, Ministry of Health, Mozambique. Mr. Bader Avlathani, Director General of Information Technology from the Sultanate of Oman. Dr. Preetha Rajaraman, Health Attaché and Regional Representative, Department of Health and Human Services of the Secretary of the for Global Affairs, Embassy of the United States in India. And the representative from the European Union, the European Union's delegation in India, Dr. Benoit Savaroche. Ladies and gentlemen, allow me to welcome the moderator for this high-level plenary session. This high-level plenary, Dr. Prem Namgyal, Director for Program Management, WHO Regional Office. For more discussions on critical transformational milestones in digital health, ladies and gentlemen, I have the pleasure in handing you over to Dr. Namgyal to moderate this high-level plenary. Thank you, ladies and gentlemen.
Thank you, Gautam. Your Excellencies, distinguished delegates, ladies and gentlemen, it is my pleasure this morning to moderate this extremely important high-level plenary session of this two-day meeting on digital health. The MC has already introduced all the distinguished speakers for this high-level plenary session, and I will straight away jump into requesting the distinguished speakers. First of all, Dr. Mansukh Manaviya, the Honorable Union Minister of Health and Family Welfare and Minister of Chemicals, Fertilizer, Ministry of Health and Family Welfare, Government of India. Your Excellency, yesterday we were fortunate to hear your opening address where you highlighted many of the notable achievements that India has made in such a short time frame, which not only benefited India, but also many countries beyond the borders of India. Today, we are doubly pleased and fortunate to have Your Excellency with us physically, despite your very busy schedule to be here with us. And I would like to request Your Excellency to give your thoughts in your keynote address to this plenary session this morning. Therefore, Your Excellency, once again, thank you very much for being with us, and over to you, Your Excellency. Yeah.
Good morning, everyone. sitting on dais, dignitaries, ladies and gentlemen. It gives me immense pleasure to be here with distinguished guests on the second day of Global Conference on Digital Health, which has provided a global platform for enhanced cooperation and technology-driven solutions in health sector aimed at taking universal health coverage to the last mile. Digital health interventions are not just limited to individual healthcare delivery programs, but are spread across multiple health outcomes, catering to both communicable and non-communicable disease across the health and disease burden spectrum. India has taken a quantum leap towards leveraging digital health solutions for effective health service delivery. I would like to highlight a few achievements of the country in the digital health and service delivery domain, which showcase India's capacity to scale technological advancements for a country of 1.35 billion people. In the maternal and child health domain, India has created name-based database of 200 plus million eligible couples, 140 million pregnant women, and 120 million children who are being monitored for antenatal, postnatal, and immunization-related health services. Another key example is the Nikshay intervention under the National TB Elimination Program, through which more than 11 million patients are tracked for adherence to TB treatment. India's focus on comprehensive primary health care is underlined with the NCD application, through which more than 15 million population with 30 plus age has been screened for 5 NCDs, in turn creating a health profile for India. Using integrated health information platform, which was developed in collaboration with the World Health Organization as a national surveillance system, we have ensured name-based GIS-enabled near real-time surveillance of 36 epidemic-prone diseases. E-Raktakosh, all the blood banks across the country, and online reservation systems application provides online appointment for government facilities across the country. And Mera Aspatal for giving feedback on health services provided by the hospital. Other well-known pan-India applications included e-Sanjeevani and COVID. e-Sanjeevani was largest telemedicine network, ensure free of cost online telemedicines, video calls to citizens. So far, more than 100 million teleconsultations have been conducted through this platform. The globally renowned COVID vaccine management platform has supported administration of more than 2.2 billion COVID-19 vaccine doses. Friends, yesterday, I have touched upon the 4 pillars on Ayushman Bharat. the Long Live India mission. Today, I would like to opportunity to delve deeper on the digital aspect of the Ayushman Bharat digital mission, which is cutting across all domains for enablement of digital health ecosystem in the country. Under ABDM, the government has initiated creation of registry for patients in the form of unique patients' IDs, health provider registers, and health facility registers as an essential foundation for any health programs to be interoperable with other programs. More than 332 million unique patients' IDs, more than 200,000 health facility registers, and more than 144,000 health professional registries have been created so far under ABDM. Taking forward the government's focus of breaking the silos, ABDM will lead to the creation of longitudinal health record of patients, which can have been burning of continuum of care across primary, secondary, and tertiary levels of care. ABDM also enables newer technologies and advanced data analytics to be integrated with existing solutions aimed at avoiding repeated diagnostics, accurate diagnosis, precision medicines, increased quality of care, timely response in emergencies, and lowering out-of-pocket expenses. While India is already working toward creating an enabling ecosystem for digital health in country through various policy level reforms, implementation and scaling up of this digital intervention is parallelly focused often. Friends, even though we have utilized multiple technological intervention in health, we have still leveraged only the tip of the iceberg. Truly, digital transformation requires multi-pronged efforts with special emphasis on leveraging cutting-edge technologies, such as artificial intelligence, machine learning, and both logic and AI-based clinical decision support system to achieve the overall vision of digital health ecosystem. Indian government has taken ambitious steps towards convergence of advanced technologies in the delivery of healthcare services in the country. Premier tertiary care institutions of the country like AIIMS Delhi, AIIMS Rishikesh, and PGI Chandigarh have been designated as the Center of Excellence for Artificial Intelligence in Healthcare, with an aim to enhance adoption and promotion of health data standards. The Center of Development of Advanced Computing, Pune, has been designed as the National Resource Center for AHR standards to achieve synergy between siloed and vertical national health program. A national public health observatory has now been established at Union Health Ministry level, with nodes at state and district level, which will yield the twin benefit of effective public health monitoring and health emergency management. Based on our learnings, I would like to highlight the 3 policy enablers which every government should prioritize. First would be digital architectural frameworks for a country for establishing a digital ecosystem. Secondly, government should ensure standardizations of data, focus on data security, privacy issues. Third, integration of multiple applications for data-driven policy making should be major focus globally. Government of India believes that digital tools have immense potential and can play a critical role in strengthening and transforming healthcare delivery system. At this juncture, it is crucial to converge our efforts toward building a culture of interoperability in development of digital solutions, not only at the country level, but also globally. Further, greater focus is required on supplementation of global investments instead of duplications in investments, and there is a need to create a unified global health architecture. Under the G20 motto of One Earth, One Family, One Future, India is working towards greater collaboration and sustained efforts across the digital health ecosystem. Leveraging its G20 presidency, India is also encouraging development of common global platforms for sharing of medical countermeasures, technical knowledge, digital infrastructure, and cost-effective digital health solution. I'm happy to note that this conference has brought together varied stakeholders from the global digital health community. These stakeholders must now ensure that the coordinated efforts are sustained and momentum built is carried forward. It should be our collaborative efforts to support each one at every stage for making these worlds a connected healthcare system without boundaries. Thank you. Thank you very much.
Thank you, Your Excellency, for highlighting the quantum leap that India has made and the many, many notable achievements that India has demonstrated, clearly indicating the digital prowess that this country has. I think this only goes, any tool that you're talking about and its application, when we hear the numbers, it is mind-boggling. It's always millions and beyond. So it's truly mind-boggling. And yet that it is being effectively implemented, I think shows how well it is thought of and how well it is being implemented. And I would like to commend Your Excellency for your path-breaking leadership in making or in ensuring that India achieves this. And all of us who are here in this room look towards that leadership and beyond. Now, I would like to request His Excellency, Mr. Joe Bejang, Honorable Minister of Ministry of Health of the Marshall Islands, we go from a very large country to a relatively small country. But even small countries do need the same solutions because people are same and health needs are same. Therefore, I would like to request His Excellency, Mr. Joe Bejang, to provide us or give us his thoughts or reflections and the experiences on digital transformation and the challenges and the vision and the roadmap that he may foresee as the Marshall Islands forges ahead. Your Excellency, over to you.
Thank you. Ladies and gentlemen, on behalf of His Excellency President David Kabua and the people of the Republic of the Marshall Islands, I wish to convey our appreciation to the Ministry of Health and Family Welfare. I wish to convey our appreciation to the Government of India and WHO Southeast Asia Regional Office for allowing the Republic of the Marshall Islands to share insights and inputs at this global conference on digital health. The Republic of the Marshall Islands is home to approximately 60,000 people, with over 20,000 people living abroad. It is located approximately midway between Hawaii and the Philippines. It is one of the most remotely situated countries in the world, with a total land area of just 70 square miles spread across 30 atolls and covering an area of 750,000 square miles in the mid-Pacific. The RMI also has one of the most widely dispersed populations in the world. RMI is facing a huge geographical challenge in ensuring taking USC to the last citizen. Dealing effectively with our geography requires that we build both a robust digital and transportation infrastructure. Unfortunately, we are hampered by living with virtual monopolies, both in communications and air transport sectors, resulting in high cost and poor services, and together putting a major drag on our economic and social development. With transport costs so high, the development of digital health infrastructure offers major economic advantages, including the opportunity to target our services more effectively, to reduce the inefficiencies in management of medicine and supplies inventories, and through telemedicine, to reduce the need for medical evacuations and the hiring of in-country medical specialists. Despite the physical distances between us, we are making headway with our commitment to realizing the healthy islands vision and ensuring healthy lives, taking UAC to the last citizen and sustainable futures for all. Use of digital innovations such as digital health is one of the possible key solutions. The development of neighboring islands information and communication technology in the last 2 years have been successful with the installation of VSAT amongst 49 health centers out of 54. We continue to explore the needs of vast data sharing and collaborations of information between health services providers, clinics, and hospitals by updating and/or upgrading the systems and infrastructures. In fact, the RMI Ministry of Health Web IZ, or immunization system, transition from on-premises to cloud computing technologies were successfully implemented. Being on a cloud system with the presence of internet connection, it provides uninterrupted access for our immunization staff to our Web IC data entries, validations, and reports. Through other projects to support TB mass screening in the neighboring islands or outer islands, WHO and UNICEF donated tablets which allowed online, if available, if Wi-Fi is available, or offline data collection of the screening, which will be uploaded to a centralized database. This data system, which was supported by the Taiwan government, also captures and sends off immediate X-ray results to physicians in the urban centers. Our ministry has been using this equipment for other outreach programs and consolidated data inputs, such as for immunization program. Further, RMI has accumulated a good experience through emergency management of neonatal and obstetric care training to health assistants working in these outer islands where Health assistants connect to doctors at a hospital in the capital city, which is Major, and get consultation, mainly by a radio call. This initiative was supported by WHO, CDC, Taiwan, and UNFPA. This kind of telehealth consultation has been useful to reduce the last-minute emergency referral, as health assistant gets to advice by doctors, specialists early on. In general, internet connection in neighboring islands is gradually improving, thanks to the development partners' investment. In addition to health centers, some schools in outer islands now also have internet connection. Recently, a joint communique between the Ministry of Health and the Marshall Islands Mayors Association in all the neighboring islands have been signed, which enhance better coordination with the Ministry benefit health assistant to get more support from the mayors in partnership with the education sector. Beyond ICT infrastructure, I wish to also share the workforce development with the respect to digital health that has been placed. The training over the past 4 years of 4 successive cohorts of health staff in applied epidemiology and informatics through the delivery of the Fiji National University accredited data for decision-making program, available through our regional Pacific Field Epidemiology training program. We, however, continue to engage with multilateral discussions digital health. Recently, UNICEF is working with the ministry to administer a software called Rapid Pro, which enables a two-way SMS communication system that will be used as a reminder system for antenatal clients and routine immunization. Of course, none of these achievements or efforts are possible without the support of all of our development partners, including WHO, UNICEF, US, UNFPA, UNDP, and the Taiwan government. It would be remiss on us not to acknowledge their invaluable financial and technical assistance. In summary, RMI still has various challenges in implementing digital health. In terms of infrastructure, that is internet and IT equipment, available workforce and their capacity, policy, strategies, and standards, fragmentation in health information systems, and etc. But there is an opportunity for a strong leadership and commitment by both the national and local government to utilize innovations, including digital health, to deliver quality care to those citizens living in the remote areas and outer islands. The vision and roadmap for the digital health transformation in the Marshall Islands. As stated earlier, RMI does not have a comprehensive national digital health policy or strategy, but our ministry's vision for the health sector is what we call Kumidi Ejimur, or health is a shared responsibility. And one of the priority areas includes quality care in outer islands and access to care for communicable and non-communicable diseases, mental health and substance abuse, immunization, healthy lifestyle, preventive and public health, climate change, and health security. Because of our geographical challenges with the outer islands, digital health transformation will be inevitable to bring UAC to the last citizen. We can share one example of ongoing digital health transformation through a project supported by WHO. Through this project to support an integrated TB and leprosy mass screening in the outer islands, WHO and UNICEF donated tablets which allow online or offline data collection of the screening results, which will be uploaded to a database that was integrated into the centralized database system supported by Taiwan government. Further, the data collection system was supported by the WHO CLO office, WebPro's IT department, which enables to collect a fingerprint of those people who come for screening. The strength of this data collection system is that every person is registered with a unique ID using fingerprint registration. The Ministry of Health and Human Services in the RMI has been using this equipment for other outreach program and also consolidated data inputs such as for immunization program and NCD screening. It is very powerful to have those equipment in the field, as health workers can immediately check the status of vaccination of children. For NCDs, it is also extremely important to follow up individuals for necessary referral and continuous NCD management at primary healthcare level. Having a unique health ID support such provision of continuum of care. While people health program data information are being consolidated through such initiatives, there is an ultimate goal to link them to the electronic medical health records at a hospital through an unique health ID, which is yet to be realized. We are aware that all these interventions should not be implemented in an ad hoc way, but should be based on a coherent enterprise architecture for health information system in RMI. Building on all of these achievements so far, RMI is therefore keen to consider developing a national digital or e-health strategy, along with its implementation plan or investment roadmap to pursue a robust and sustainable digital health transformation for UHC. As it is also happening in FSM by WHO support, RMI is also interested in seeking WHO support to initiate a systematic telehealth pilot in one or two of our referral outer islands where a nurse practitioner is stationed and where it is expected to provide support to smaller health centers in the outer islands. Once again, I convey RMI's utmost appreciation and heartfelt thanks to the Ministry of Health and Family Welfare, the Government of India, WHO, Southeast Asia Regional Office for the invitation and allowing RMI to attend, participate, and learn from your experiences and successes. Thank you so much, Komoldara.
Thank you very much, Your Excellency, for highlighting the many achievements that the Marshall Islands have made, and at the same time highlighting the many challenges in ensuring that no one is left behind in your attempt to reach healthcare that is of quality to everybody across the country. I would like to now move to the Regional Director, Dr. Poonam Khetapal Singh. When the Regional Director took over as the new Regional Director in 2014, she presented to the region a vision of health, which she prioritized into flagships, initially 7, later adding another to make 8 flagships. The 8 flagships have been the focus and the core thrust of her leadership in CRO for the last now almost 10 years in this region. When the SDGs were launched in 2015, the 8 flagships fitted, the flagships fitted very well with the core thrust of the SDGs as well. And when WHO launched the GPW13, the core areas presented and covered under the GP13 also very well aligned with the flagships that Dr. Poonam Khetapal outlined. I would like to ask you, Madam, how has digital technology supported and their implementation, and how it can be leveraged further in supporting member states to achieve further progress? Over to you, Madam.
Honorable Ministers, ladies and gentlemen, the moderator has already mentioned that, yes, in 2014, I did identify some priorities for the region with the member states. And the basis of that was that whatever we do in the region should not be spread too thinly, so that we have some programs that we can focus more on and then get results at the end of it. And what was the basis of identifying these priorities? Basically, we looked at the burden of disease, we looked at the CCS, the health plans that countries had. We looked at the WHO resolutions, both in the World Health Assembly and the RC. And what was very striking was that all countries, regardless of what stage of development they were in, economically, culturally, politically, or what their population was, the priorities that were outlined in the matrix after a very careful examination seemed to be across all the 11 countries of Southeast Asia region. And therefore, we started working on these, trying to see that a major part of our resources, both technical and financial, were focused on that. Now, what is the connection between that and the subject of today, which is digital health. Now, when we look back, we find, and the Honorable Minister of India has already shared that how they use digital technology for RMNHCH services. We looked at that. We looked at the example of India. We could share it with other countries of our region, because I do feel that is also WHO's mandate to pick up the best practices from countries, share them with other countries so that they don't have to reinvent the wheel and they can proceed seeing what has worked somewhere will work for them. As far as these flagships were concerned, we saw successes in most of them. And just to name a few, in CDS, that is communicable diseases, we did focus on those diseases which could be eliminated. And we looked chiefly at measles, we looked at rubella, we looked at malaria, we looked at other diseases like NTDs, because I do firmly believe that neglected tropical diseases are truly neglected. They are the diseases of the poor, and much focus is not given to them. In our region, we could have 14 eliminations across different countries. And I'm very sure if we did not have COVID-19, the list of eliminations would have been much larger. We also looked at NCDs, because there is more mortality from NCDs today than from communicable diseases. So it becomes an area of great relevance and importance to us. We find a lot of success in tobacco control. How that has been able to, the tobacco use has been reduced sharply if we look back the last 2 decades. And that is the success story in emergency management, which was another priority of ours and which COVID-19 brought to the fore. We saw in COVID-19, and it has already been shared by the Honorable Minister, the amount of teleconsultations that were done. 100 million teleconsultations in a country is really not easy. There are a lot of challenges there, but that could be done. I mentioned one. Of course, there were many others which you've already heard about, and not wanting to duplicate or go into details, I thought it's important for us to just highlight some of these things that had been done. Now, COVID-19 also brought out the importance of digital technology, because that is when the realization came that digital technology is extremely important for the success of different programs of our region. Immunization is one such program, which was heavily dependent on digital technology. In our region, as far back as 2014, we had a strategy on e-health, and we worked towards it. In 2020, we have a global strategy for digital health. And in that, we find that the focus is more on what has already been discussed a lot yesterday, that is governance, data protection, collaboration, knowledge transfer, and human-centered health systems that would provide guidance and coordination on global digital health infrastructure and transformation. So that is where the stress is now. We also find that to support the implementation of the global strategy, a few innovations were brought about. Let me mention those. One was the Digital Implementation Investment Guide. Now, this is very important because we do understand that all countries of the region do need technical support, which WHO is very willing to give and is very forthcoming with. They also need financial resources. And this investment guide gives fundamental steps to support resource mobilization in countries and to see how they can successfully navigate the process from where they are today to where they want to be. We also had the Digital Clearinghouse, which will serve as a global framework on standards, promoting interoperability to support person-centered systems and continuity of care through seamless data sharing. And we've had several discussions on this yesterday also. It was highlighted that we cannot work in silos. Data sharing is extremely important. Interoperability is extremely important if we want digital transformation to really be there. Digital Health Atlas was also brought out, and this atlas is an inventory of important digital health initiatives across the world. As I mentioned, it's very important to learn from countries who have already been successful in certain areas rather than to reinvent the wheel. In 2021, WHO also produced guidance on ethics and governance of artificial intelligence for health. Artificial intelligence is talked about so much, and WHO thought it's important to have consultations with leading experts in ethics, in digital technology, law, human rights, as well as experts from the ministries of health. Working with them, the report identifies the ethical challenges and risks which arise when artificial intelligence is used for health. Moving forward, what is it that WHO needs to do? Moving forward, WHO remains committed to help member states in every possible way. And some of those mechanisms I have already outlined. WHO is working hard to reduce siloed approaches of digital health solutions, which can be counterproductive, and therefore to integrate them and to work together is extremely important. We don't want to duplicate efforts in a situation of scarce financial and technical resources. WHO will also continue to strengthen human capacity to enhance digital literacy and competency-based capacity, which becomes very important. This will help to galvanize the digital health transformation and reduce the risk and the frequency of investments in siloed, disease-specific digital tools and structures. Finally, WHO will continue to facilitate global collaboration. Our role is very important as a facilitator, and that is what we will focus on. Strengthen global mechanisms to support the implementation of the global strategy through development of roadmaps by countries. And we are all aware of that strategies are easy to make. But unless we have roadmaps and unless we know how to proceed step by step on achieving what the global strategy talks about, it becomes extremely difficult to do that. So our next step is to see that countries of our region have this roadmap. And we will organize a meeting where we are going to talk about a plan of action. And that normally we do after a strategy is developed, because I do feel those steps are very important to achieve what we really want to achieve. So we will continue to strengthen human capacity to enhance digital literacy. We will continue facilitating global collaboration among various agencies in the digital space. We will strengthen global mechanisms to support implementation of the global strategy through the development of the roadmaps I just mentioned. And we will align WHO norms and standards to reap the full benefits of digital health. It has a lot of potential, and we can do a lot in that space. And that is what our thrust will be. Thank you, moderator, for your question.
Thank you, Madam Arti, for highlighting all the initiatives under your leadership that has taken place in the region of Southeast Asia. In addition, I'm sure the distinguished delegates from the countries here would be very happy to hear what WHO can do, such things as enhancing digital literacy, using WHO's technical capacity to build capacity in countries, and then helping countries develop roadmaps so that they can move forward with the implementation of digital plans, which every country has or are in the process of developing. So thank you, Madam, once again. Let us now move on to the speakers from the countries. I have first on my list, Ms. Nina Bergestedt, Senior Advisor, Office for Data, Infrastructure, Cybersecurity, Ministry of Interior and Health, Government of Denmark. Innovation is one of the important pathways to the development and growth of digital health, both in terms of expanding the footprint and in terms of the impact on patients and citizens. What steps do you think should be taken to promote innovations in digital health? And do you see relevance of digital health sandbox for promoting innovations? Over to you, Madam.
Thank you. Good morning, honorable ministers, government representatives. First of all, thank you for inviting me to share my perspectives from Denmark, and congratulations to the organizers for a successful first day. I hope this will be as inspiring. I will share my thoughts on the steps to promote innovation and the use of digital sandboxes. In Denmark, we have a solid digital foundation that benefits patients and health professionals every day. We have in many years worked with digital strategies, and we are believed to be one of the most digital countries in the world. But we are facing a situation with more elderly, more people with chronic disease, and a shortage of nurses and doctors. So we need to do things differently, and we see a digital transformation is part of the solution. Digitalization, innovation must be centered around clinical needs and making the healthcare is efficient. We need to address that some digital solution creates overtreatment, takes time to document, and we don't have the resources to implement those solutions. And the way we have a focus on the clinical need is to have a better cooperation between private and public sector. I see that innovation often is generated from tech companies, from startups, from innovation organizations, and that is natural. They are trained with digital mindsets, innovation mindsets. Nurses and doctors, they are not trained innovators, but they are experts in clinical needs. So we need to bring the experts in innovation, the experts in clinical needs together to build an ecosystem between the private and public sector. The third aspect that I will highlight today is, as a member state of the European Union, the coming regulation of a European health data space that are being negotiated actually these days. This regulation will have a massive impact of the health system in the European Union. It's providing rules of individual rights to data, common infrastructure, standards to share data in member states, but also between European countries. This is very ambitious, but if it succeeds, it will enable innovation through easier access to data. So I would suggest you to have an eye on this regulation. So my closing remarks is on the use of digital sandboxes. And I see a potential in using sandboxes in developing, especially data-driven new technology. The European General Data Protection Regulation is necessary for protecting the sensitive health data, but it is often seen as a barrier working with small-scale innovation projects. In that aspect, digital sandbox can be a solution. We have in Denmark been working with synthetic data. This is data that are generated from computers, but they look like real data. And this makes it easier dealing with the data protection, working with, for example, AI. I also do see some challenges that need to be addressed working with sandboxes. And I think the difficult part in implementing new technology, it's the changed workflow, it's trusting the evidence, and we see a cultural resistance. And we see this, we call not invented here syndrome, that organizations may avoid implementing things that are not coming from themselves. So the challenges with digital sandboxes is that the solution, the project is tested away from the organizations that has to implement it. And that can be a challenge in implementing the innovation. So we need to take care of that. So just to sum up, innovation is crucial for making health sustainable, but we have to focus on the clinical needs, making the health efficient, and it has to be done in a close cooperation between public and private sector. Thank you.
Thank you very much, Ms. Bernadette, for your thoughts on the potential value of digital sandbox, and also sharing your thoughts on how we can support the development of digital health. I would like to now turn to my neighbor here, Mr. Badr Aulathani, Director General of Information Technology from Oman. A complex program like digital health requires multi-stakeholder approach. What more do you think global organizations like WHO should do to accelerate the adoption of digital health? Over to you, sir.
Good morning, everyone. Your Excellencies, participants from all the countries, online and here in Prims. I would like to congratulate to Government of India, Minister of Health, really for the achievement has been done in terms of the digital health. And really we're feeling proud of yesterday. I'm sharing the information about the digital health and the achievement has been done in these countries, and we're wishing all the best for the next period of times. When we talk about, I'm going to come back to about the questions, but let me briefly talking, when we developing the digital health solutions and the initiatives for all the countries, we should keep in consideration the patient expectations. So this is the journey started. It's not starting from the ministerial levels. We should start it from we are the normal peoples, and we used to take the facility from the government. So the digital solution should be started from the patient expectations, because the patient's journeys, it's starting from the birth until the death. So if you imagine that the informations which is already gathered from the birth until the death, it is a huge information. And that information, it is not belong to the Ministry of Health only, because the other stakeholders also, they are waiting and they are looking forward to get that information to make the decisions and serving the citizens to get the services. For example, if the birth notifications, it is not shared with other stakeholders and the government, again, they cannot make also the planning, for example, the vaccination programs, the other. So I'm going to elaborate a little bit about the experience of Sultanate of Oman and what we did it before 20 years ago in terms of the digitalizing the institutions of the ministries. We take the decisions of developing our in-house systems, HIS, System Health Information Systems. It's called the Shifa, and the system is now, it is working in around 279 institutions in Oman. And that really make us a more strength of developing the other supportive systems, because we have a base, and the base is available to be used for that institutions. So after that, after we did our implementation of the 279 institutions, we moved to the supportive systems, and the supportive systems which already link with the HIS systems of referring patients, and also the notifications, communicable disease notifications, and the others also supportive systems, which helping the practitioner doctors to make their decisions. So after that also, we moved to our HIE systems, and HIE systems also already developed in-house and already is covered now more than 200 institutions, where we're exchanging all the informations in one warehouse. So that's all the elements and achievement has been done, really helping the country to develop the mobile application and a mobile health. Now we are moving to mobile application where our patients, our citizens and residents, they can view the informations from the single systems. They can book appointments, and also they can generate all the informations available belong to the patients and citizens. Again, to the questions, how the WHO is, accelerating and helping the countries to develop. Of course, really the WHO, they are doing the great works. Is not now, since I have been attendance of the digital workshops and seminar of the WHO, and really it was the hot discussions about how to helping the country to move forward about the digital health. So I think that the COVID-19 is the game changers for all the countries. The COVID-19 giving the countries to speed up the digital health. So the change management is very, very important in all the country to be adopted, because we see that the resistance is there from all might be the stakeholders when we're talking about the digital health, but that can be addressed by the change management program strategy to address and to accelerate the digital health. Also building the capacity of the human resources. This is very important because, when you're developing the systems, don't think the systems are going to develop it and implement it, and then you forget about the enhancing the systems. The enhancement of the systems, improvement of the systems, and the solution should be continuously, should be also aligning with the change in all the countries, because there is the change in the healthcare facility is there. Also, is we know that in the COVID-19, it was the difficulties and the challenge of the cross-boarding of the data sharing informations, especially when you talk about the COVID vaccine pass, when the travelers moving from one country to another country, it was really the difficulties for some of the travelers to share the information, to authenticate that certificate of the COVID-19. That should be also addressed. And I suggested to the WHO to discuss about thinking further of exchanging the information between the country to another countries. Regarding the investment and financial models, that also already elaborated and already addressed. And this is very also important to be considered about the sustained model to be cover all the digital initiatives of the strategy. And also we should think about not duplicating the work. This is very, very important to be considered, because we saw that there is a lot of the initiatives, a lot of the experience of the country in the digital health. And we request WHO with collaboration with all the countries really to support the other countries who is required the help and the support in terms of the digital health. Again, the strategies, when we doing the strategies, we should doing the national assessment of the gap analysis and the national assessment of the systems, because that is very, very, very important. When you talk about the stakeholders who is providing the healthcare, you know that we have a different type of the stakeholders in the countries, starting from the government to the private, for the military, and the other also society who providing the health services. Because the patient is the patient, he's moving from one provider to another provider. But at the end, if the information it is not shared between all the stakeholders, that it will affect the decision making of the treatment of the patients and also the planning for the future for enhancing the services. I would like to thank you very much for giving me this opportunity to talk, and wish you all the best.
Thank you, sir, for your excellent talk. And we take note of those areas where your suggestion for WHO to support countries in that. Thank you very much, sir. Let us now move to Mozambique. I would like to invite Mrs. Bernardina de Souza, Deputy Director for Professional Health Training, Ministry of Health of Mozambique. I understand that Ms. Bernardina would have interpreter support. So may I know? Oh, okay, so we're all set. All right. Please, madam, over to you.
Bom dia a todos. Excelências, prezados dignatários, caros colegas.
Good morning to you all. So all the ministers here and everyone.
É com grande honra que me apresento a esta magna conferência global sobre a saúde digital em representação do nosso país, Moçambique.
It's a pleasure for me to be here and representing Mozambique.
Queria também aproveitar esta oportunidade para agradecer à Organização Mundial de Saúde pelo convite que nos foi feito e também ao nosso país anfitrião, Índia, através do Ministério de Saúde, pelo caloroso acolhimento que nos deu.
I would like as well to thank WHO for inviting Mozambique to be here in this conference, as well the India for receiving Mozambique.
Moçambique tem uma população aproximadamente de 32 milhões de habitantes e abraçou o Ministério de Saúde em 2018 a plataforma da telesaúde.
Mozambique has about 32,000 million inhabitants and has embraced the health system in 2018.
Dentro daquilo que é a plataforma da telesaúde, o Ministério de Saúde abarca 3 áreas, a dizer, a teleconsultoria, a telegestão e a teleeducação. A telemedicina ainda é um grande desafio no país.
Okay.
Queria dizer que nós abraçamos a 3 áreas, nomeadamente teleeducação, telegestão e teleconsultoria. A telemedicina ainda é um grande desafio.
Okay. I'd like to say that we embrace 3 different areas, the telecommunication, but the telecommunication is still a problem for us.
Foi-nos colocado uma questão: que tipo de apoio os governos precisam para garantir que os investimentos externos e domésticos em sua transformação digital de saúde sejam eficazes? Como é que os nossos governos poderão ter, dentro daquilo que é o apoio externo e doméstico, para que essa transformação digital seja eficaz no país?
Okay. One question was put to Mozambique, how the telecommunication can help to solve some of the problems related to the health system.
Tendo esta questão, eu colocaria alguns pontos para que, de fato, a transformação digital, da saúde digital, seja efetiva no país. É necessário que o país tenha uma política de saúde digital efetiva.
Okay. First of all, to solve one of the problems, what we really think is the necessity of the country to have an effective digital healthy policy.
Para além da política, nós temos que ter a regulamentação. Sem esta regulamentação, nós teremos muitos desafios, como já vemos no país.
So, and also we need to have the regulation that is still not there and has already caused some issues regarding to it.
Dentro do país, nós já começamos a ver várias iniciativas individuais. Cada instituição vai fazendo a sua intervenção, mas não existe algo que é regulamentado e harmonizado dentro do país.
We still see that some providers are still doing the work, but they are not connected between them.
O segundo aspecto é o investimento na infraestrutura, no equipamento e também na comunicação para o sistema de informação digital.
Another one is the investment in the infrastructure, equipments, and communication and the IT system sector.
Nós, como Ministério da Saúde, colocamos algum equipamento ao longo do país, principalmente para atingir as zonas mais remotas. E porque há províncias que não têm nenhuma possibilidade de ter acesso.
Okay. The government has already provided some of the population with the service, but it is still like on the remote areas or the most rural areas that do not have the contact with the technology.
Outro aspecto é o investimento de recursos humanos para esta área, mas também como fazer a sua retenção no sistema de saúde.
Another one is the investment in the HR on the healthcare system, and also how can the workers can be retained and also be educated to continue the work.
O outro aspecto é a criação da capacidade de cultura digital.
Okay. The country doesn't have the cultural digital idea. So to build and work to capacitate the people on the digital area.
Nós dizemos isto porque ainda há uma grande resistência de usar estas plataformas da telesaúde ao invés de fazer formações, portanto, treinos presenciais.
We still have some resistance of people about the use of the communication for the online capacity.
A criação da capacidade de condições no setor de saúde para responder às preocupações dos doentes, a capacidade de consultas entre os clínicos, pois a nossa população, maior parte, 85% acima dele, usa ainda os cuidados, portanto, os cuidados de saúde primários.
Okay. Educate the health workers on the health units to provide the best to their patients. And still we have 85% of the population who is still using the service.
E não menos importante, nós dizíamos a largura da banda para a internet e a falta de rede celular avançada como o 5G.
Mm-hmm. So to highlight it here is Mozambique is still not have a great broadband service like 5G, but it makes it very difficult to have the broad or to get in contact with as many part of the population as possible through the digital area.
A percentagem da nossa população em termos de usuários da internet ainda anda por volta de 20%.
So only about 20% of the population has access or use the internet in Mozambique.
Portanto, estes eram os aspectos que eu queria partilhar com esta Assembleia sobre as principais áreas que nós gostaríamos que o nosso governo tivesse apoio para a sua implementação efetiva. Nós podemos dizer, na altura da Covid, da pandemia da Covid, vimos o grande desafio e a grande vantagem que tivemos com a formação dos clínicos para o diagnóstico e tratamento portanto, da doença por Covid-19.
During the COVID, so we could see how technology really helped on the treatment or to how diagnose and how to educate the front line to serve the population as better as possible. And with that, so Mozambique could save a huge amount of money and as well use the technology to better the service to their patients.
E podemos observar que durante a pandemia de Covid tivemos a oportunidade de formar aproximadamente 2.000 colegas da área da saúde e com esta formação através do Zoom online conseguimos poupar aproximadamente $1 milhão.
Okay. Throughout the Zoom, so Mozambique could educate 2,000 people that were on the front line. And with this, though they had a saving of $1 billion that could have been, that is going to be used in better other parts of the necessity of the country.
Por isso, está claro, e nós estamos comprometidos como país a avançar com o apoio de todos vós para podermos alcançar esta meta, que é ir até ao último, portanto, elemento da nossa população na área mais remota do nosso país.
So with that, we really hope to get the help of all of you to really provide the health until the most remote parts of our country.
E muito obrigada pela atenção dispensada.
Thank you all for the attention.
Thank you, Madam, for sharing your thoughts. And I would like to thank our interpreter for her service. Greatly appreciated. May I now turn to Dr. Preeta Rajaraman, Health Attaché and Regional Representative, U.S. Department of Human and Health Services, Office of Global Affairs, Office of the Secretary, U.S. Embassy in New Delhi. There is a consensus on the pivotal and critical role of digital health that digital health can play in transforming health services. Can you provide your insights on the key enablers of digital health, for instance, policies on data protection, data sharing, telemedicine, etc.? Over to you, Madam.
Thank you so much. Excellencies, dignitaries, colleagues, and friends. Let me first express our deepest thanks to the Government of India, the Ministry of Health and Family Welfare, and the WHO Southeast Asia Regional Organization for gathering this wonderful group of policymakers and implementers to highlight the essential role of digital health in accelerating progress towards universal healthcare. This is a promise that we witnessed in real time when we saw the power of digital innovation to tackle the formidable challenges of the COVID-19 pandemic through platforms such as CoVIN, eSanjeevani, and so many more. But even before and certainly beyond the pandemic, digital health and innovation have become increasingly critical to a strong healthcare system. We've seen the evolution of these technologies over the last decade, from very simple patient portals and basic electronic medical records to a much larger ecosystem that includes healthcare devices, telemedicine, artificial intelligence, machine learning, comprehensive data science, and so much more. But in order for these technologies to reach their full potential, we need to have some key enablers in place. We've already heard many examples of these during the discussion yesterday, this morning. We know that we need to create a policy framework, use evidence and evaluation to ensure safe, quality products, address privacy, security concerns, ensure interoperability among systems as well as nations. And last but not least, engage healthcare providers as well as consumers to ensure true value to the end user. Within the United States, these different enablers of digital health are largely addressed by agencies within our Ministry of Health, the Department of Health and Human Services. At the federal level, policy recommendations for telehealth are largely led by the Health Resources and Services Administration, or HRSA. Data privacy and security, interoperability, and the standards-based exchange of health information are led by the Office of the National Coordinator for Health Information Technology, or ONC, and many of you in this room have worked closely with them on digital health. Innovation and development, on the other hand, including those technologies that accelerate the